Hello, everybody. Hope you're having a good day. So today we're gonna do the post-colonoscopy series here. So after you finish your colonoscopy, you're supposed to have a driver to drive you home, and then after that, what you expect it. You're not gonna get your result right away because they probably, if you have polyps, they probably just sample it out and they need to send it to a lab. And depending on your lab, it might take a couple weeks before you get the results. So you do, before you check out, you do want to check whoever driving you, hopefully is your family members, can ask when you're gonna expect the results back. They might tell you, they might not tell you. Like, as you're waiting, you might want to start asking questions. They're supposed to give you a aftercare guide, which probably somehow useful and not exactly for our cases. So they would just, for our cases, they just say resume regular diet and start eating high fiber, with high fiber milks because they always assumed they will assume people need a high fiber diet because they that will help pooping with a blanket statement without considering each patient being different. They might tell you, if they're nice, they might tell you to gassy, it might have pain, watch out for pain. They might recommend to take some non-blood thinning painkiller, like over the counter, like Tylenol or something. Ask your provider what you should be taking. For our cases, it was Tylenol. It doesn't have to be Tylenol. Just ask them which one. If Tylenol is okay or whatever you have handy is okay, you might want to prep that before you even go to colonoscopy in the first place, which they should tell you, which they didn't. They might tell you something like I said, go back to your regular diet, which might not be the best suggestion, to be honest, like after our experience, because if anything goes south, they might likely to need to require to stick the camera back up to see if you have bleeding inside. So if you imagine, if you clog up a system with a, I don't know, like McDonald's or whatever, they might not be able to see very clearly, right? That's just a dumb suggestion, like from them. They would not tell you, which they should, to take a small sip of water first, to take it slow, to do a softer diet before you increase to a regular diet. That would be what a good doctor tells you, to check, make sure you're fine before you, wolf down a feast. So that's that. They if you have uncomfortable with the gas that they put in because you feel bloated, you feel like bloated, full because of all the gas inside. One of the suggestions was to use hot water bottle on your tummy as if you're on period, and that might help the tummy situation a little bit. Not everyone will have a hot water bottle. You might have those like gel ones. I don't know which one is better. I'm not a I like hot water bottles, and I happen to have two at home. So I'm old, so I have hot water bottle all the time. So that is helpful. If you have something equivalent that would help, that is help that can be considered. What I found, and it's before I even have colonoscopy, is if you sleep on your left side or if you lie down your body on the left side, it helped the passing of gas better in general. And in general, you shouldn't be passing the gas out, you should be letting it absorb, kind of. One of the things on the checklist is like you don't fart too bad or blood out, bleeding out too bad. I think the sheet says 50 cc, as if anyone know what 50 cc is. So you do want to check what is 50 cc before anything. And this is not medical advice. This is just our experience, by the way. So just check with your provider for everything. And you should not have black stool. The blacker it is means the higher up it was bleeding. So you shouldn't have any bleeding in the first place. So you shouldn't have black stool, and you shouldn't have 50 cc of liquid blood, or like reddish blood out, kind of, in theory. Yeah, and you shouldn't have like flecks of clots coming out from your butt. If anything, then they would treat that as an emergency. You shouldn't have fever, inflammation, like anything like that. So you do want to check your temperature. Hopefully, you have a temperature taking device aka thermometer. Well, actually, now these days, no one uses thermometer, so you probably use the in-ear one, handy at home, to use in case you didn't feel well. You should not. Your whatever you're having should subside in, like, 2 days or whatever people said. And yeah, that's basically the expectations in terms of prepare after. For our cases, if you imagine, like, you would not know if you're bleeding inside until you either fart or poop, for like I was saying, right? A normal person would not have bowel movement very easily and quickly. It might take like 2 days before you can poop, a normal person, because you just flush out the system. At a normal person, in this case, poop the next morning. A good 24 hours, by the way. Poop the next day, and there were blood. There were a lot of blood. Like I said, the gauge we were told is no black poop and 50 cc. That's our instructions. It might be vary for provider, and no one will show you a picture. It's like this is normal and this is not normal. Kind of. So it's kind of hard. But everyone I asked, except for the person that has an inflammation after, did not have what we experienced, and we freaked out and we go to the hospital. And just to gauge how much blood we are talking about that we freaked out, the amount of blood was as if a healthy woman on a heavy period. So it's like a lot, like as if it would suck through the bad type of blood. So it's a lot of blood. So we went to the ER and we were there for a good 9 hours or something. Basically, what they will do, they check you in, you take forever. They're gonna ask you if you're in pain. If you're not in severe pain, your priority is lowered, even though you probably might be having internal bleeding potentially. Your priority somehow is lowered because you're not in pain. Just saying. And you're not in fever, symptomatic wise outside beyond your bleeding from the butt. So again, like I said, it was heavy because it was heavy bleeding. If they're suspecting you're having bleeding, they probably have like two venue. One is to do an imaging to see if you're bleeding severely. That's basically in general for everything. For gastro, they will do a CT scan with the contrast. So that's one of the imaging they would do. Other things like do a different imaging, but like for just for our cases happen to be a CT with the contrast. So that's one. The second one is they might do a bunch of lab works. So there's like three types of lab works. So there's like the urine test that I don't know why they even do it, but they did it anyway. The urine test just to see if you have peeing blood or if you have infection or something. So that's one of the tests. The second type of test is your blood clot time. So you're told not to use blood thinning medicine slash supplement slash whatever. So in theory, normal person's blood should clot at certain time window. They'll run a test to see if you're a bleeder, basically. So that's one type of test. There's more than one lab for that. And the second type of test is just to test your general like health, like as in your blood count. If if you're bleeding, you might show anemic in your blood work. So they basically try to figure out if you're bleeding, basically in short, through labs. So those are the three types of labs they would do. If they're good, they order all at once. If they're not good, they don't, and they are like ordering over and over again, and which means you have to draw blood multiple times when you are already like weird for a lab, I was saying. So that's what happened to us. I'll put I'm not gonna put I'll put some of the example of the labs that they did in terms of the names of the labs, but in the description. But in general, they're just gonna do a bunch of urine tests and labs and stuff that I just said, and imaging. The imaging they already said is not 100%. I mean, you can see if you're like flushing blood for lab, I would say, but if it were like slow sleeping and stuff, it's not 100%. and maybe you are a bleeder, like I said, right? So the CT is not 100%, but then the next best thing will be sticking a colonoscopy, asking you, referring you outside to do another colonoscopy, and then you probably have to flush again, and before they can even do the colonoscopy. So for our case, they just say, go back and resume regular diet, and if you're not bleeding more than you are in the poop, then you're fine. Maybe you just takes longer than normal person to cure, like to be fine before. So that's what happened to us. We did have multiple bowel movement with blood afterwards, and we realized if we take the softer the diet is, the less likely the chance we get blood in the stool. So that's what we did basically for a whole week of like basically really soft food. So I'm gonna give some examples here. That's why I show here. You have applesauce. That's one of the things that you could do. You can do banana bread for our case. Because I was thinking, okay, I need to do the reverse. It needs to be low fiber instead of high fiber, which is what they recommend discharged note. I'm gonna do lower fiber, like banana bread, because it basically is like kids' food for that best thing. Soup, I love soup, any kind of soup, but just soup. Like canned soup. We did open our Pokemon Campbell soup collection for that purpose because I was not prepared to have, because most likely the adult soup has fiber in there. Usually it's 1 grams of fiber and whatnot. But because I'm trying to avoid that, the kids version has like no fiber usually. Like there's no vegetable, no celery in the chicken noodle soup that the Campbell's, the adult version, the red can, versus the other one. The red can has the celery and tomato and like green flakes in there. So I was trying to avoid and progress to that red can. So we opened our Campbell's Pokemon collection for that. Because the Campbell's Pokemon collection would not have any of those vegetables there. It's just pasta and clear, like new, like broth. So that one is, like I said, is progressive from soft, like from liquid to soft, to to more fiber. So that's what we've been doing for the whole week or so, and it works for us. We didn't go crazy. There's no beef involved in the diet at all for like a week or so. Actually, probably like 2 now. We go back to the colonoscopy suggestion like whitefish, chicken, small bites, bananas, zucchini, kind of slowly introduce. Like broccoli is probably like the last, no raw vegetables. Zucchini is like smushy, like potato, right? And then I would try to avoid stuff like gassy as well at the same time, which is hard because potato is still gassy. So you kind of like gauge yourself. Like carrot is definitely gassy, sweet potato is gassy. So you just have to move up your rank to have solid food eventually, which we're still going there, but we're not. And one thing we didn't prepare is, like I said, we went 9 hours in ER. For anyone has anything procedure-wise, even though colonoscopy is supposed to be not exactly like extreme procedure, and like I said, majority of people don't have a problem, except one person that I asked has inflammation as well. So if you have inflammation, even though you have no poop, you still farting, I guess, maybe blood liquid out potentially. So that's like, again, a lot of blood is or red liquid pool is probably like your questioning if you have a problem, kind of. Ours is more mucus, jello-y, red, bloody black stool. The person that I asked his is a red puddle. Let's put it this way. So yeah, and what helps is if you can take pictures of your poop before and after, kind of. I mean, nobody wants to look at your own poop, like, by staring at a toilet bowl unless you're into it, sure. But easiest will be take a good picture of it, and then, you look at the picture to see, because you can then relate what you ate versus what is coming out. So that's what is helpful for us. Like, for example, if you eat an orange, you should see some zest potentially, kind of stuff, like kind of relating the food to your output, kind of. So that's what helpful. That's why the suggestions of, like, chow down, whatever you could find, like, at McDonald's slash steak house and stuff, it might vary by person. If you're a very healthy, no complication, not your first timer, of course you can do it. If you're a first timer, like the situation here, you might want to tone it down and just go easy on yourself, because shit might happen for all cases. Yeah, it was actually the whole ordeal is actually not very helpful either, because even when we discharged to ER, I did ask for like stuff what to look for is basically population, like your heartbeat, irregular heartbeat, if you're having hard times breathing, if you are having more blood than the current stool, that's basically the gauge, because you should be improving. That's what basically that was the concept I was getting from the doctor. If you're having fever, then you need to go back and they would do the colonoscopy, because they don't want to do more damage than it was. So basically just watch it at home closely. So yeah, so that's that. And like I said, because you're 9 hours or so, because ER don't really have a food and water really, like there's water, but it's like if you're at the back where you're doing like all the blood water imaging, there's like not easy access for those compared to outside. So we basically have a good time of 9 hours, nothing including the driver, which is me. In my case, is a driver. So you might want to, in general, it's not just for colonoscopy. In general, you want to have a prep bag as you part of your procedure, whatever procedure. Make sure you have prep bag in case you need to be, worst case scenario, hospitalized, or good case would be the next day you just need to stay a couple hours in ER. You have food and water in your pack, probably underwear as well in case you need to stay overnight, and toothbrush potentially even, like whatever you need to stay one night, in your car or in your bag or near your door, so that in case you need it, you just like carry it out. We were not prepared at all. Because we were told it's a small thing, right? Because everyone brush it, saying it's easy. So that's why I just want to put it out as a warning. The hot water bottle definitely helps. We've been using it for a long time, and we happen to have two, so we can kind of like switch half day, kind of to keep it warm. So that was good. And take it easy, depending on if this is your first timer and if you are like your health has problems. Do talk to your provider before, kind of in general. But like I said, ours just say regular diet, because they're like, how bad can it be? Because if you were already bleeding, it's better to have food when you're bleeding than you have no food. That's even worse. And I guess I get some of it, but then like I thought it was a little bit irresponsible to say go back to your regular diet right away. And I think the high fiber thing probably is also problematic. Like they should have say ease to high fiber potentially. But yeah. Anyway, hope you guys enjoy today's part 2 video. Is a lot of complaints. It is not everyone having issue, but when you have issue, there's so little information that you're told what to expect, what to do, because they just say go to ER, and then it's like, okay, what exactly after that, like, kind of. So yeah, hope you guys enjoyed today's video. Give me a like and subscribe. Until next time, have a good one, guys. Bye.